Okay, Mrs. von Sanden, could you let us know what draw your attention to the Pfeifer Protocol? How are you using it, and what are your experiences?
Yeah, I am using the Pfeifer Protocol since more than 10 or 12 years. I think I started in 2011 or 2012. And with my first patient, I had such an impressive result in only 1 month. And after taking the protocol for 1 month, we have had very good PSA. And so I told the laboratory, wow, I think you are wrong. So maybe it's maybe we need another test. And the laboratory said no. I mean, it's our standard test. We did today so many tests, so we don't have a problem with our machine. And so with that first patient, I made my first experience. And before I wrote an email to Professor Pfeifer, asked him what is how do I prescribe it? Where does the patient have to buy all the things, and how does he have to take it, and can he take it morning and evening? So I was completely new in this field, and so he was just a good teacher in the background and writing his emails, and I had so many questions. And by this time I started to explain it to other patients. I'm a family doctor, so I am not a urologist. So, but if they come and they say, well, now I have a carcinoma, and what can we do plus the normal surgery or radiation or whatever they suggest the patient, so I can explain the Pfeifer Protocol. And I have now a good experience. And nevertheless, I have sometimes questions and I don't know, what do we now do? And so I go to the email or to my mobile phone and send a WhatsApp to Professor Pfeifer. And so I can ask him still my questions concerning the protocol.
Yeah, that's amazing. So the Pfeifer Protocol is basically a combination of different products that get combined.
Yes.
And that basically led, in your case, to a decrease of the PSA value.
Yes, yes, it is like he explained it to me. When I asked him, oh, the patient now, he just wants to take ProstaSol because he's complaining about taking so many different pills. And he said, well, we cannot do one pill with everything, so you have to see it like a flower bouquet, and with the flower bouquet you have different things, and it works better if you take the whole thing, because we have some synergistic effects, and the synergistic effects are the thing why the protocol is working better with 5 or 6 different pills than with only one. You have effects with only one pill. If you take ProstaSol, you often see an effect on the PSA and decrease. But the problem is if you only take it this for a long time, it won't get the biggest results. So take the whole flower.
Take
bouquet.
the whole bouquet. Take the whole bouquet. Yes, exactly.
Yes.
And the dosage can be adjusted within the treatment. So to say that you have a higher dosage in the beginning of the treatment, and you can lower the intake of tablets and tablets in time.
Yes, this is, you always have sometimes a side effect. I remember a patient in the United States. It's a friend of our family, so I told him to begin with that, and he had massive diarrhea in the beginning. So this was, I don't know why, I've never had this kind of, but he was taking also a lot of other different things, so this was a little bit difficult to manage. And so you always have to control, sometimes each month, sometimes even a little bit before. Sometimes you can have longer periods, so you adjust it really very individual, but you start normally higher. And then you can say, okay, it's okay, we can try it with a little bit less of the pills.
Of the intake.
Yes.
And that also decreases the cost that a patient has to take, has to carry usually.
Yes,
correct?
that decreases,
The very interesting thing is that some people do not expect side effects. If you tell them that's a product that only has only natural ingredients.
Yeah, phytotherapy. Yeah, you think it's like a herb. Yes, so if you have a cough, though, you take a little bit of some thymian or something like that. No, I tell the people, I have had 2 times a very big side effect. Once it was emboli in the lung, and this was during the Pfeifer Protocol. And of course, it is also because there has been some cancer cells. But we have had this. Then the patient took also a kind of blood thinner. I don't tell now the name of it, not to make but so he did take that, and then he stopped without telling me, and then he get a second time one. So after that he was he took this blood thinning medication. And the other patient, also on the Pfeifer Protocol, he came with hurting on his leg, and so I said, oh, it could be thrombosis, and as a deep vein thrombosis. And so we took some blood and take it's called in Germany the D-dimer. I think it's the same in English. And so we say, and now also he was on the blood thinning medication. So it's a really effective therapy, but sometimes also with side effects. Because you're not taking only something for the cough or for the throat.
Correct. Yeah.
Is it easy to get, for us it was a little bit complicated to get the things from Holland to the USA, because I remember the story, we took it to Hamburg airport, there was someone from our friends who took all the things because of the customs. So how do you manage it to get your protocol to the States or to wherever?
The problem is in this case not the customs, but the FDA, the Food and Drug Administrations of the US. You have to get your products that will be sold in the US market. You have to get them registered, and this process takes like forever. And they have very, very high standards and question some of the ingredients that are part of our products. So when people travel to the US and take our products with them for personal use only, which was the case in this case, that is usually totally okay.
Yeah, we did it like that, but we were so confused that we couldn't send it with a normal parcel service. So we needed a person to get at this time to the States.
Personal courier.
Yeah, so personal courier. Yeah, and this is a little bit strange.
And you combine the Pfeifer Protocol with your regular medical treatments that you give to patients, or do you either do one way or the other?
Yes, normally I do either the one or the other, and only in combination with the urologist I can say, okay, now we take some parts of the Pfeifer Protocol, but normally we are in a good situation. We have, for example, a period where the normal school medication is not working, but there is no harm of getting more metastasis or something like that. So we can say, now we have a period, we try the Pfeifer Protocol. And so the combination with other medication, of course, but with some other things like Xtandi or so, I am always talking to the urologist where the patient is in treatment.
And while the pharmaceutical products are all covered, at least here in Germany, by the health insurance, what are the experiences with food supplements or the ingredients of the Pfeifer Protocol? Is this also refunded by health insurances?
Seldom, rare. And we try to take all the laboratory tests, the results, and we said, it's fantastic, look here. And they say, oh, it's nice for the patient, so go on with that. But for us, it's a phytotherapy and it's not covered with our things. So my experience is not very good with the covering of insurance.
Understand. And the Pfeifer Protocol is specialized in prostate, the treatment of prostate health issues, so to say, if I don't want to mention the word cancer. Are you?
I also now start with the new release for the prostata hyperplasia. The
Prostapinol.
Yes, the Prostapinol, and I'm now collecting my experiences with that, because I prescribed it now to a couple of patients, and now I will see how it works, because I don't have other things than surgery, and the other products on the German market are not really good working. So I'm really curious if Prostapinol is also from Professor Pfeifer, and I'm curious if it's working.
Yes,
but I don't have enough experience right now, and but I hope it will work.
Not
because
yet,
we have thousands of people who run 3 times a night to the toilet, men, in this time, and so they would be glad. There are other, of course, also school medication, but my question is, maybe we get a prostate from 90 milliliters volume, a little bit smaller, to 70 or 60 milliliter. I don't know. We will see.
We will see. It would be great if you could share this information with us. Your feedback would be highly appreciated. One last question. The therapy of cancer in general, how did the phytotherapy approach of the Pfeifer Protocol, how did this change your view towards the cancer therapy in general?
Well, for me, it's just that I see there is so many hope for a lot of strategies that are not on our normal way, but that are on an alternative way that is not as harmful as the other treatments. And for me, it's something that I already knew when I started with homeopathy, because we have different ways. Sometimes it's not the right way, but it is good to test it. And we have now more and more strategies in specialized laboratories to measure the blood for in vitro, and then we can measure, is it good to give him this and that therapy, and maybe it's for the patient better to see, okay, I get my infusion with curcuma, and I need not to take my infusion with vitamin C, for example. And this is good if we now have more and more tests to measure the blood before, and then to say very selectively, okay, this is maybe good, but you don't have to spend your money on vitamin C, but spend your money on curcumin. And so this is something I hope it won't be so expensive. At the moment, it's very expensive, the blood test, and also the problem that insurances are not willing to pay. But maybe in future times, we can get all those tests for the half of money.
Yes. That would be great to have a very selective therapy, so that you do not
yes,
need
like we have in school medicine, to say we have a very targeted therapy. Yes, and also we need a targeted therapy in the phytotherapeutical sector.
Absolutely.
Yeah. Mm-hmm.
Well, that was a very interesting conversation. Thank you so much for taking your time. Hope to see you soon.
Thank you.
We will keep in touch.
Thanks to Professor Ben Pfeifer.
Yes.
For inventing this nice therapy.
Absolutely.
I'm really grateful that he did this work for the people, and I hear that he's still working and still treating patients all over the world.